Well, when I first started back in 1975, it was the Washington State Health Facilities Association, better known as WSHFA, and we were all in one association. The corporation that I worked for organized and split off from them, and we organized United Nursing Homes. And for a number of years, we were two different associations. At some point, it became practical for us to get back together again. So I had been on the board of United Nursing Homes. We put the two back together again, and I was on the board of Washington Healthcare Association.
I think it's really important to take this time to recognize the efforts of the board, which in turn benefits the entire membership. The amount of time these individuals contribute is astounding. I would like to take this moment to sincerely thank all past and current board members for their service.
One of my favorite memories is all the camaraderie that we have, we've all had our own individual personal stories and experiences, and it's just been so much fun, and I have wonderful friendships of people that I've known all this long time, and I think those memories and all the fun that we've had, besides all the trials and tribulations that all of us have gone through, to be able to provide for our residents and to know that we all were working toward the same goal.
Some of my lifelong friends have been made due to this association, and we make each other better, and we all want and are striving for the same thing, which is quality for our residents.
I'm a nurse and a physical therapist. I've been in long-term care actually since 1977, and I started my career at Anderson House with Larry and Lova Anderson. I started with them as a nursing assistant, and I was fresh out of high school, working my way through college. I became the restorative aide, and that's where I fell in love with physical therapy and nursing.
The greatest accomplishments, I think, for WACA would just be keeping ahead of what's going on for our members and the many, many, many regulations and educational requirements that we have to stay on top of, providing services to them for the least amount that we can, and get back for them savings in whatever way we can. And I think that we can do that because of the resources of the people that work here and over the years. We have people that started out at WACA and originally wrote the reimbursement system. That was Jerry Reilly and Donna Ganders. We're a valuable service for our members, and I think that we're very conscientious about making sure that we still continue to be that.
I have said to so many people through the years, join the association, join the association. Of course, as nurses, they don't have a lot of power. Try to talk your administrator into joining the association. Join the association. You need the support, you need the education, you need the help.
The education that WACA gives is absolutely heads and tails above anything else I have seen. The networking is fabulous. The round table. When I came into this business, like I said, I knew nothing. I didn't even know what questions to ask. I didn't know who to turn to. They're an incredible resource. They reach out to you if you need anything. And I mean, I've contacted Robin, Vicki McNeely at the time, now Elena, Brenda, Juanita, Diana, Sandy, across the board. I mean, I never ever hesitate to call any of them, and they will. If they don't know the answers, by golly, they'll give me really good information on where to look.
The first time I was invited to go to the Capitol, I went there with Lori St. Hours, and I met her up there. It was definitely the first time I had ever interacted with legislators, and so I was a little nervous. Lori St. Hours was so calming. She was there to coach me, but the thing that she reminded me also is not to be nervous when you go in to meet with your legislator, because they're an elected official there to represent our interests, and they don't know a thing about long-term care oftentimes. They couldn't, and so they're going to look to us as an expert, and that's what we really need to do, is to bring in how the decisions they make affect our ability to provide care to these residents.
I always enjoyed visiting facilities, seeing the real compassionate care that was going on in the facilities, and meeting residents. I recall meeting two sisters at the Pasquale Care Center. One was 100 and one was 98. And they were having a birthday celebration. And she was able to tell me about being a child in Oklahoma when they had the great land rush. And she and her sister were young girls, and she remembers riding in the back of her father's wagon. And she told me the story of they being those Sooners. And so to see somebody who was connected with that part of American history was something memorable. And I met many great people in visiting the facilities, and you sit down and listen to their stories.
Well, you know, people that know me know I like people, and living in Brewster, there isn't any people. It's a very small town, 2,000 is where it is, and if you want to see people, you have to go to Spokane or Seattle. Or you come to a WACA event, and there's all kinds of people. And over the years, I've become very close to many members of our association. So coming here and being here is like hanging out with family, friends, people you can talk to because they know and understand what we do for a living. You don't have a problem thinking, oh, I better not say that, it'll get around town. And it's nice to be able to relate with one another on issues that we're all concerned about.
I can't imagine operating in this long-term care arena without being a member of Washington Healthcare Association.
As far as the future, I think the future is extremely bright. We've got the right people in place. We've got membership that makes up 80% of the skilled nursing market in the state, 70% of the assisted living market, and we can do a lot more with that support and that help, and I'm very optimistic about the future.